Performing a thorough physical assessment is a critical component of caring for your patient. It helps healthcare providers gather objective data about the patient's health status, identify potential health issues, and develop an appropriate treatment plan.
Before starting the physical assessment, ensure that the environment is comfortable, well lit, and private. Gather all necessary equipment such as a stethoscope, blood pressure cuff, thermometer, reflex hammer, otoscope, ophthalmoscope, and measuring tools. These items can be scary for children, so we suggest using kid-friendly items and introducing them in a fun way when examining the pediatric patient.
Certain age groups require a tailored approach to the physical exam. For infants, we recommend assessing the patient lying in the parent or caregiver's arms and leaving ears, eyes, and the mouth to the end and using the least to the most invasive approach. Assess the heart and the lungs when the infant is quiet or asleep, and try distraction techniques with older infants. Infants less than 6 months are best examined on the table.
For toddler-aged children, use minimal contact, allow inspection of your equipment, like the stethoscope, assess the heart and lungs, and then proceed with the head-to-toe approach. This approach also works well for preschool-aged children.
For school-age children, the provider should make sure to respect privacy, explain the steps of the visit, and approach to the physical exam before beginning.
For the adolescent patient, the physical exam is similar to that of the school-aged child. Be sure to explain physical findings, respect privacy, and ask parents to leave the room during part of the exam to gain rapport.
When starting a comprehensive physical examination, maintain open and effective communication with the patient. Explain each step, address any concerns or questions, and ensure their comfort and dignity. This will help with building rapport with your patient. Be sensitive to the patient's age and cultural background. Adjust the assessment techniques and communication style accordingly to ensure the patient feels respected and understood.
Begin the exam by assessing the patient's vital signs: blood pressure, heart rate, respiratory rate, and temperature, and general appearance, noting the patient's behavior and overall condition. Note any signs of distress, discomfort, or abnormalities.
Now it's time to perform the head-to-toe assessment. In this assessment, you will systematically assess each body system from head to toe. This typically includes the following areas. For the head and neck, inspect the scalp, face, eyes, ears, nose, mouth, and throat. Palpate lymph nodes and assess the range of motion of the neck. For pediatric patients, be sure to assess the fontanelle size, the eyes for the red reflex, and the mouth, noting the number of teeth present.
Moving on to the chest and lungs, auscultate lung sounds using a stethoscope and assess respiratory effort, symmetry, and any abnormal breath sounds.
For the cardiovascular system, auscultate S1 and S2 heart sounds and assess peripheral pulses, jugular venous distension, and edema.
For the abdomen, inspect, auscultate, percuss, and palpate the abdomen to assess for tenderness, organ enlargement, masses, and bowel sounds. Note that infants usually have protuberant abdomens that become more scaphoid as the child matures.
Musculoskeletal system. Observe range of motion, muscle strength, joint stability, and any deformities or abnormalities. In the pediatric patient, note any signs of lordosis, scoliosis, kyphosis, or sacral dimple. Additionally, physiologic bowing is often seen in children under 2, before spontaneously resolving.
For the neurological system, you're going to want to assess their mental status, cranial nerves, motor function, sensory function, reflexes, coordination, and gait.
The integumentary system. Inspect the skin for color, temperature, moisture, lesions, rash, and wounds. Assess skin turgor and perform a full body skin assessment, including the scalp, nails, and mucous membranes. Evaluate children for birthmarks, hemangiomas, and Mongolian spots.
For gender-specific assessments, evaluate the genitalia, perform a breast examination for females, and assess urinary patterns and function. Note the Tanner staging in the pediatric patient. For the gynecologic patient, a speculum exam is used as well as a bimanual exam to assess the vagina, cervix, uterus, and adnexa. Be sure to include a focused examination based on the individual's presenting concerns or symptoms. When documenting your findings, include pertinent positive and negative findings, abnormal findings, and any concerns or observations. Use clear and concise language, ensuring the information is organized and easily understandable.
Use appropriate terminology and include relevant measurements, abnormalities, and any subjective information reported by the patient. A comprehensive physical assessment should be tailored to the patient's needs and pertinent to the chief complaint.